Our bodies are marvels of nature, intricate networks of systems working in perfect harmony. We often take our health for granted. But sometimes, these processes can go awry. One such condition is deep vein thrombosis, or DVT. It's a silent threat, often undetected until it strikes. DVT can affect anyone, regardless of age or lifestyle. To truly grasp the significance of DVT, we need to journey inside our bodies, to the often overlooked world of veins. These unsung heroes carry deoxygenated blood back to the heart and lungs for replenishment. Imagine them as rivers, flowing steadily towards the heart. Veins have one-way valves, ensuring blood flows in the right direction. Deep veins in our legs carry most of the blood from the lower extremities. These deep veins are like major highways, handling significant blood flow. Blood clots, while sounding alarming, are actually a natural and essential part of our body's defense mechanism. When we experience an injury, our bodies swing into action, forming blood clots to stop bleeding and promote healing. These clots act like internal bandages, plugging the damaged blood vessels and preventing excessive blood loss. They are a testament to our body's remarkable ability to protect and repair itself. However, the same clotting mechanism that safeguards us can sometimes work against us, leading to complications like DVT. When blood clots form within the deep veins without any injury, or when they don't dissolve naturally, they pose a serious health risk. These unwelcome clots can partially or completely block blood flow, leading to pain, swelling, and potentially life-threatening complications. Deep vein thrombosis is not a rare occurrence. It's a global health concern affecting millions of people worldwide. The statistics are startling, painting a clear picture of the widespread nature of this condition. It's estimated that DVT affects about 1 in 1,000 people every year, highlighting the need for increased awareness and understanding. The impact of DVT extends beyond individual cases, presenting a significant burden on healthcare systems globally. The economic impact is substantial, with costs associated with diagnosis, treatment, and management of DVT-related complications. Moreover, the emotional toll on individuals and their families can be immense, underscoring the need for comprehensive care that addresses both the physical and emotional aspects of this condition. Deep vein thrombosis, often referred to as DVT, is a condition that can be both perplexing and concerning due to its often subtle symptoms. In many cases, individuals with DVT may not experience any noticeable signs, making it a silent threat that can escalate quickly. This lack of prominent symptoms makes awareness and understanding of the potential indicators crucial for early detection and intervention. While some individuals may remain asymptomatic, others may experience a range of symptoms that can vary in intensity. Recognizing these potential warning signs is paramount, as early detection and treatment are vital in preventing serious complications associated with DVT. It's important to remember that experiencing any of these symptoms doesn't necessarily mean you have DVT, but it warrants consulting a healthcare professional for proper diagnosis. Leg pain, a common ailment often attributed to muscle strain or overexertion, can sometimes be a red flag for something more serious, like deep vein thrombosis or DVT. While not all leg pain indicates DVT, it's crucial to be aware of the specific characteristics of DVT-related pain to distinguish it from other, less concerning causes. The pain associated with DVT typically originates in the calf and can feel like a cramping or Charlie horse sensation. It can be a dull, aching pain that intensifies with time or worsens when standing or walking. Unlike muscle pain that typically eases with rest, DVT pain may persist or even worsen when the leg is elevated. Swelling in the legs, ankles, or feet can be a common occurrence, often attributed to fatigue, prolonged standing, or even hot weather. However, when swelling appears suddenly and is confined to one leg, it could be a telltale sign of deep vein thrombosis, or DVT. This type of swelling, known as edema, is a direct result of the blood clot obstructing blood flow in the affected leg. The swelling associated with DVT typically affects the entire leg, from the foot to the calf and even the thigh. It can be painful and tender to the touch, and the skin over the swollen area may appear stretched and shiny. The swelling may be more pronounced after prolonged periods of sitting or standing and may temporarily subside with elevation. While the symptoms of deep vein thrombosis, or DVT, can be subtle and easily dismissed, it's crucial to recognize the warning signs and seek immediate medical attention if you suspect you might have this condition. Ignoring these signs can have serious, even life-threatening consequences. If you experience any of the following symptoms, especially if they occur suddenly and are accompanied by other DVT symptoms, it's imperative to seek emergency medical care without delay. Sudden shortness of breath. This could indicate a pulmonary embolism, a life-threatening complication of DVT where the blood clot travels to the lungs. Chest pain. Chest pain, especially when accompanied by shortness of breath, can also be a sign of a pulmonary embolism. Rapid heartbeat. An increased heart rate can be a sign of your body trying to compensate for the reduced blood flow caused by a blood clot. While deep vein thrombosis is commonly associated with the legs, it's essential to remember that blood clots can form in the deep veins of other body parts as well. Although less common, DVT can occur in the arms, pelvis, abdomen, and even the brain, leading to a range of complications depending on the location and severity of the clot. DVT in the arms, also known as upper extremity DVT, is often associated with the presence of central venous catheters or pacemakers, which can irritate the veins and increase the risk of clot formation. Symptoms of arm DVT can mirror those in the legs, including pain, swelling, tenderness, and a feeling of warmth or tightness in the affected arm. Deep vein thrombosis, often referred to as DVT, is a complex condition influenced by a multitude of factors. It's not always one single cause, but rather a web of risk factors that can intertwine, increasing an individual's susceptibility to developing this potentially life-threatening condition. Understanding these risk factors is crucial for identifying those who may be more prone to DVT and implementing preventive measures to mitigate their risk. Some risk factors, like age and genetics, are beyond our control. However, others, like lifestyle choices and certain medical conditions, can be modified or managed to reduce the likelihood of developing DVT. By being aware of these risk factors and taking proactive steps to address them, we can empower ourselves to make informed decisions about our health and well-being. Age, an inevitable part of life, plays a significant role in our overall health, including our risk of developing deep vein thrombosis, or DVT. As we age, our bodies undergo a series of changes that can increase the likelihood of blood clots forming in our veins. These age-related changes affect the composition of our blood, the structure of our blood vessels, and the efficiency of our circulatory system, all of which can contribute to an increased risk of DVT. With each passing decade, our risk of developing DVT doubles, making it increasingly important to be aware of this condition as we get older. While DVT can occur at any age, it is relatively uncommon in young adults and children. The risk starts to rise significantly after the age of 40 and continues to increase with each passing year. While age is a significant risk factor for deep vein thrombosis, it's not the only factor that comes into play. Certain medical conditions can significantly increase an individual's risk of developing this potentially life-threatening condition. These conditions can range from inherited blood clotting disorders to acquired illnesses that disrupt the body's natural clotting mechanisms. One of the most significant risk factors for DVT is a previous history of the condition. Individuals who have experienced DVT in the past are at a significantly higher risk of developing it again, emphasizing the importance of long-term preventive measures for those who have had a previous episode. While age, genetics, and certain medical conditions can significantly influence our risk of developing deep vein thrombosis, our lifestyle choices also play a crucial role in shaping our vascular health. By adopting healthy habits and making conscious decisions that promote good circulation and reduce the likelihood of blood clots, we can actively lower our risk of DVT, regardless of other risk factors we may have. One of the most significant lifestyle factors contributing to DVT is a sedentary lifestyle. Prolonged periods of sitting or lying down, especially during long flights or car rides, can slow down blood flow in the legs, increasing the risk of clot formation. It's crucial to stay active and keep the blood flowing, even during long journeys. Section 5. Genes and DVT, a family affair. While lifestyle choices and certain medical conditions play a significant role in our risk of developing deep vein thrombosis, or DVT, our genes also have a say in this complex equation. Inherited blood clotting disorders, also known as thrombophilias, can significantly increase an individual's likelihood of developing DVT, often at a younger age than those without these genetic predispositions. These inherited disorders affect the body's natural clotting mechanisms, making the blood more prone to clotting, even in the absence of other risk factors. If you have a family history of DVT, especially if a close relative developed DVT at a young age or without any apparent reason, it's crucial to discuss this with your doctor. Section 1. The diagnostic journey. Unmasking DVT. Diagnosing deep vein thrombosis, or DVT, is like solving a medical mystery. It often begins with a suspicion, a nagging feeling that something might be amiss. Perhaps it's an unexplained leg pain, a sudden swelling, or a combination of subtle symptoms that just don't feel right. This initial suspicion is the first step in a diagnostic journey, a process of gathering clues, conducting tests, and piecing together the puzzle to determine if DVT is the culprit. Unlike some conditions with clear-cut symptoms or readily available diagnostic tests, DVT can be elusive. Its symptoms often mimic other less serious conditions, making it easy to dismiss or misdiagnose. This is why a comprehensive approach, involving a detailed medical history, a thorough physical examination, and often a series of diagnostic tests, is crucial in confirming or ruling out DVT. Section 2. Ultrasound, a glimpse inside our veins. Ultrasound, a non-invasive imaging technique that uses sound waves to create pictures of internal organs and tissues, has emerged as the cornerstone of deep vein thrombosis, or DVT diagnosis. This safe and painless procedure provides a real-time glimpse inside our veins, allowing doctors to visualize blood flow and identify any obstructions that might indicate the presence of a blood clot. During an ultrasound examination for DVT, a special gel is applied to the skin over the affected area, usually the legs. A small handheld device called a transducer, which emits and receives sound waves, is then gently moved over the skin. These sound waves bounce back from the veins, creating images that are displayed on a monitor. Section 3. D-dimer test, detecting clotting activity. While ultrasound provides a visual assessment of the veins, the D-dimer test offers a glimpse into the body's clotting activity, providing valuable information that can aid in the diagnosis of deep vein thrombosis, or DVT. This simple blood test measures the level of D-dimer, a protein fragment released into the bloodstream when a blood clot breaks down. Elevated levels of D-dimer in the blood can indicate the presence of a blood clot somewhere in the body, but it doesn't necessarily pinpoint the location or cause of the clot. A D-dimer test alone cannot diagnose DVT, as elevated levels can also be associated with other conditions, such as recent surgery, infection, pregnancy, or even advanced age. Section 4. Venography, mapping the veins. While ultrasound and the D-dimer test are valuable tools in the diagnostic workup for deep vein thrombosis, sometimes a more detailed assessment of the veins is necessary. Venography, a minimally invasive procedure that provides a comprehensive map of the veins, can offer this detailed view, helping to confirm the diagnosis and guide treatment decisions, especially in complex cases. Venography involves injecting a special dye, called contrast medium, into a vein in the foot or hand. This dye travels through the veins, making them visible on X-ray images. As the dye flows through the veins, a series of X-rays are taken, creating a detailed roadmap of the venous system, highlighting any areas of blockage or narrowing. Section 5. Beyond the basics, advanced imaging techniques. In some cases of suspected deep vein thrombosis, especially when the diagnosis remains elusive despite initial testing or when the location of the clot is unclear, more advanced imaging techniques may be employed. These advanced techniques provide highly detailed images of the blood vessels, offering a comprehensive view of the venous system and aiding in the diagnosis of DVT in challenging cases. Computed tomography scans, particularly CT venography, can provide detailed cross-sectional images of the veins, allowing doctors to visualize blood clots and assess the extent of the clot burden. CT scans are particularly useful in diagnosing DVT in the chest, abdomen, and pelvis, where other imaging modalities may not be as effective. Navigating treatment options. A personalized approach. Treating deep vein thrombosis, or DVT, is not a one-size-fits-all approach. It's a journey that requires careful navigation, guided by the expertise of medical professionals who consider the individual's specific circumstances, the location and severity of the clot, and any underlying health conditions. The goal of DVT treatment is twofold: to prevent the clot from growing larger and potentially breaking loose, and to reduce the risk of complications, primarily pulmonary embolism. The treatment landscape for DVT has evolved significantly over the years, offering a range of options, from medications to minimally invasive procedures and, in some cases, surgery. The choice of treatment depends on various factors, including the size and location of the clot, the individual's overall health, and their risk of complications. Blood thinners, also known as anticoagulants, are the mainstay of deep vein thrombosis treatment, acting as the frontline defense against clot growth and the risk of potentially life-threatening complications. These medications work by interfering with the blood's clotting cascade, making it less likely to form clots and preventing existing clots from growing larger. There are various types of blood thinners available, each with its own mechanism of action, benefits, and potential side effects. The choice of blood thinner depends on several factors, including the individual's medical history, the location and severity of the clot, and the risk of bleeding complications. While blood thinners are effective in preventing clot growth and reducing the risk of complications, sometimes a more aggressive approach is needed to dissolve the clot directly. This is where clot-busting medications, also known as thrombolytics, come into play, offering a powerful tool in the fight against deep vein thrombosis. Clot busters work by activating plasminogen, a naturally occurring enzyme in the blood that breaks down fibrin, the protein that forms the scaffolding of blood clots. By dissolving the fibrin meshwork, clot busters can effectively dissolve the clot, restoring blood flow and reducing the risk of long-term damage to the affected vein. In some cases of deep vein thrombosis or DVT, blood thinners may not be an option. This could be due to a high risk of bleeding complications or because the individual simply cannot tolerate these medications. In these situations, an alternative approach, known as inferior vena cava or IVC filter placement, may be considered to prevent blood clots from traveling to the lungs and causing a pulmonary embolism. The IVC is a large vein that carries blood from the lower body back to the heart. An IVC filter, a small, cage-like device made of metal, is inserted into the IVC, typically through a vein in the groin or neck, using X-ray guidance. Once in place, the filter acts like a trap, catching blood clots that break loose from the legs or pelvis before they can reach the lungs. While medications and minimally invasive procedures form the core of deep vein thrombosis treatment, compression therapy plays a crucial supporting role. It helps to manage symptoms, improve blood flow, and reduce the risk of long-term complications. Compression therapy involves applying external pressure to the affected leg, typically using graduated compression stockings or, in some cases, inflatable compression devices. Graduated compression stockings are specially designed stockings that provide graduated pressure, with the highest pressure at the ankle gradually decreasing up the leg. This graduated pressure helps improve blood flow in the veins, reducing swelling, pain, and the risk of clot formation. Deep vein thrombosis, or DVT, while a serious condition, is often preventable. By understanding the risk factors and adopting healthy habits, we can significantly reduce our chances of developing this potentially life-threatening condition. Preventing DVT is an active endeavor, a conscious decision to prioritize our vascular health and take proactive steps to keep our blood flowing smoothly. It's about making small, sustainable changes in our daily lives that, over time, can have a profound impact on our overall health and well-being. It's about incorporating movement into our routines, making healthy choices, and staying informed about our own health. Section 2. Movement is key, keeping the blood flowing. One of the most effective ways to prevent deep vein thrombosis, or DVT, is to keep moving. Prolonged periods of sitting or inactivity can slow down blood flow in the legs, increasing the risk of clot formation. Whether it's incorporating short walks into our daily routines, taking the stairs instead of the elevator, or engaging in regular exercise, every little bit of movement counts. Think of it this way. Our leg muscles act as natural pumps, contracting and relaxing to help propel blood back up to the heart. When we're sedentary, these pumps are essentially idle, allowing blood to pool in the legs, creating an environment conducive to clot formation. Section 3. Healthy habits for healthy veins. Beyond movement, adopting healthy habits is crucial for preventing deep vein thrombosis, or DVT, and maintaining good vascular health. These habits encompass a range of lifestyle choices that can significantly impact our circulation, blood clotting mechanisms, and overall well-being. Maintaining a healthy weight is paramount. Excess weight puts extra strain on our circulatory system, increasing the risk of DVT. By adopting a balanced diet and engaging in regular physical activity, we can achieve and maintain a healthy weight, reducing our risk of DVT and other weight-related health conditions. Section 4. Medical vigilance. Early detection is key. While adopting healthy habits and making lifestyle changes are crucial for preventing deep vein thrombosis, or DVT, medical vigilance also plays a vital role, especially for individuals at increased risk. This vigilance involves regular checkups, open communication with healthcare providers, and prompt attention to any unusual symptoms. If you have any risk factors for DVT, such as a family history of the condition, previous DVT, recent surgery, prolonged immobility, or certain medical conditions, it's essential to discuss these with your doctor. They can assess your individual risk level and recommend appropriate preventive measures, which may include lifestyle modifications, medications, or regular monitoring. In the journey of understanding and preventing deep vein thrombosis, or DVT, knowledge is our most powerful tool. By arming ourselves with information, we empower ourselves to make informed decisions about our health, adopt preventive measures, and advocate for our well-being. Understanding the risk factors, recognizing the symptoms, and knowing when to seek medical attention are crucial steps in DVT prevention. The more we know about this condition, the better equipped we are to protect ourselves and our loved ones. Deep vein thrombosis. These three words, often unfamiliar to many, represent a serious, yet often preventable medical condition that affects millions worldwide. Throughout our exploration of DVT, we've journeyed through the intricate network of our veins, uncovering the complexities of this silent threat. We've delved into the causes, explored the symptoms, and examined the diagnostic tools used to unveil its presence. Most importantly, we've learned that knowledge, coupled with action, empowers us to take control of our vascular health and minimize our risk. This exploration, however, is not meant to incite fear, but rather to ignite a call to action. DVT, while potentially serious, shouldn't paralyze us with worry. Instead, it should motivate us to be proactive about our health. By understanding the risk factors, recognizing the often subtle warning signs, and taking preventive measures, we can significantly reduce our chances of developing this condition and live healthier, more fulfilling lives. Section 2. Knowledge, our greatest defense. In the realm of health, knowledge is indeed our greatest defense. It empowers us to make informed decisions, take charge of our well-being, and navigate the complexities of our bodies with confidence. Our exploration of deep vein thrombosis has provided us with a deeper understanding of this often misunderstood condition, equipping us with the knowledge to recognize the signs, mitigate the risks, and seek timely medical attention when needed. Remember the intricate network of veins we visualized, the silent and tireless workers transporting blood throughout our bodies? We've learned that these vital vessels, often overlooked, deserve our attention and care. We've discovered the subtle cues our bodies might send, the whispers of leg pain, the gentle swelling, the unexpected warmth that could signal DVT's presence. Section 3. Embracing a healthier tomorrow. Our exploration of deep vein thrombosis has been a journey of discovery, unveiling the intricacies of our vascular system and highlighting the importance of proactive health management. But beyond the science and the statistics lies a deeper message, an invitation to embrace a healthier tomorrow, not just for ourselves, but for our loved ones and our communities. Preventing DVT is not about living in fear of a medical condition. It's about embracing a lifestyle that prioritizes well-being, a lifestyle that celebrates movement, nourishes our bodies with wholesome foods, and encourages us to listen to the subtle cues our bodies provide.
Know you've been a good friend, and that's in the thick and thin. And I know it's
Section 4. Your veins, a vital network. As we conclude our exploration of deep vein thrombosis, let's take a moment to appreciate the intricate and often overlooked network of veins that courses through our bodies. These unsung heroes of our circulatory system work tirelessly day and night, ensuring a continuous flow of blood, carrying oxygen and nutrients to every cell and whisking away waste products. Imagine these veins as a vast network of rivers and streams, silently flowing within, connecting every part of our being. Just as a healthy ecosystem depends on the unobstructed flow of water, our bodies rely on the smooth passage of blood through our veins to maintain optimal health. Section 5. Listen to your body. Trust your instincts. Perhaps the most valuable lesson we can take away from our exploration of deep vein thrombosis is the importance of listening to our bodies and trusting our instincts. Our bodies have an incredible ability to communicate, sending subtle signals when something isn't quite right. It's up to us to pay attention, to tune in to these whispers and take action when needed. If you experience any unusual or persistent symptoms, particularly those associated with DVT, don't ignore them. Don't brush them aside as a simple muscle ache or fatigue. Trust your instincts and reach out to your healthcare provider. It's always better to err on the side of caution and seek professional medical advice.